All right, y'all, time for your health check. We're going to get to your COVID-19 question and answers. The first one coming from Joe via email. Are people in high-risk categories, for instance, if they have diabetes or heart disease, more prone to contracting COVID-19, or do they just have a harder time fighting it off? The answer this morning coming from Dr. Mark Casanova, the president of the Dallas County Medical Society, who says people in high-risk categories acquire the virus at the same rate as the rest of us. However, they have a harder time fighting it off and therefore have worse outcomes. Our second question comes from a viewer via Twitter who wanted to remain anonymous. She says, because of a dishwasher leak, my husband and I are having to undergo major home renovations, and we're scheduled to move into a hotel for 3 weeks in late May. We just learned that the frontline staff members of a nursing home and the hotbed for COVID-19 are staying at the same hotel. So we're concerned that if staff members are afraid of spreading COVID-19 to their own family members, what about unknowing hotel guests? My husband is in his 70s. So this, I thought, was a great question for anyone who's staying at a hotel in anytime soon. Dr. Anastasia Benson says hotels are not required to disclose whether frontline responders are staying there. Hotels usually put those guests on the same floor. Hotels are not required to disclose the medical conditions of other patrons. And hotels have recommended cleaning guidelines from the CDC. Also, you guys, you got to wear a face mask in these public areas. Keep a safe distance from other people. And if you're uncomfortable, delay your renovations or delay your stay at a hotel. All right, and our final question is from Jillian via Facebook, who writes, I've been trying so hard not to worry about all of this, but there is some early possible evidence that the virus can affect pregnancy. And Jillian's question refers to a CNBC article that came out last week. So this response coming from OB-GYN Dr. Leanne Haddock at Baylor Scott & White, who says, look, the knowledge that we have about this virus is based on fewer than 150 days of experience. Let that sink in, okay? Also, this JAMA study reviews the case of one patient who had the virus when she miscarried at 19 weeks gestation. Researchers note limitations with this study. It only involved one patient, and other causes of miscarriage cannot be ruled out. The good news, says Dr. Haddock, is that like most evidence, it shows mother-to-child transmission of COVID-19 during pregnancy is unlikely. But I've got to highlight again, more studies are needed. We're going to be hearing that a lot. More studies are needed, more time, more patience.
And it's good to clarify that, because when you read a headline, oftentimes it can be misleading.
Yeah, and this one, the headline was very scary. When I saw it, I went, and then when you actually read it, and you've got to learn sort of the art of reading a medical study or these medical journals, the reports that are released, because it might take your breath away initially, and then once you understand what you just read, you might go, oh, okay.
Okay, give some clarity to it.
Perspective, yeah, some context.
All right, thanks, Sonia.